Today we shall be discussing about the topic of stroke on the occasion of World Stroke Day. Do you know that every minute individuals suffer a stroke in our country, and many of these strokes are preventable. They can be treated well if the patient seeks timely intervention within the stipulated window period. I'm Dr. Satyan Nanda, Senior Consultant and Head of the Department of Neurology at Yatharth Hospital, Sector 110 Noida. Now coming to stroke, there are two main categories of stroke. One is an ischemic stroke, the other one is a hemorrhagic stroke. Ischemic stroke means that the blood vessel which is supplying to the brain area has a clot lodged inside it, and because of that the blood is not going well to the brain tissue which is affected by it. Hemorrhagic stroke means that the blood vessel which was supposed to carry the blood has ruptured and the blood has come out in the brain parenchyma. This is the basic differentiation of two types of stroke, ischemic stroke and hemorrhagic stroke. Now why this is very important is because the treatment for both these strokes is very different. That's why we never recommend any individual to be given any blood thinner or any other medicine at home before going for a CT scan. How you can recognize whether your near or dear ones are having a stroke is through the acronym BEFAST. B stands for balance, that is the patient may have a difficulty in walking, they may have gait unsteadiness, or they may experience chakkar or vertigo. E means eye signs, the patient may have double vision, the patient may have difficulty in appreciating visual field in one part of the eye field, or the patient may lose part or total vision in one of the eyes. Coming to F, F stands for facial deviation. There may be a facial deviation which the patients may have, and that may be the first sign of stroke. The next acronym is A, that is arm weakness. We have to raise the patient's arms for 10 seconds and see if there is any drift down. The next is S in acronym. S stands for speech. If there is any impairment in speech like speaking difficulty, or the patient is not able to pronounce any difficult words, that also signals that the patient may have a stroke. Lastly, but most importantly, time is of essence to us. As soon as we can recognize all these symptoms of stroke, it is pertinent that we transport the patient to a nearby hospital. There are multiple risk factors which are reversible. If these risk factors are taken care of, the patient's stroke incidence does decrease dramatically. Topmost among them is blood pressure and sugar. If we can control our blood pressure and diabetes, then the chances of a stroke reduce down. Thirdly, there should be an importance given to regular cholesterol checkup also, and if it is found to be elevated, it is pertinent that the cholesterol levels should be managed with the help of a statin. Smoking and excessive alcohol consumption again constitute major risk factors for stroke. Smoking should be stopped, and this should be stopped as soon as possible. We don't recommend any sort of alcohol consumption to be done. There are other risk factors also, like genetic risk factors. For example, patients may have a genetic tendency for hypercoagulability. That is a different subset of stroke patients, and that is those type of patients we manage also differently. Then there's an importance to be given to cardiac risk factors also. Multiple patients have cardiac risk factors like coronary artery disease or atrial fibrillation. None of these should go untreated. For example, if we are able to treat coronary artery disease with a good antiplatelet medicine and a statin, then the chances of stroke will also come down. If a patient has atrial fibrillation, the recommended direct oral anticoagulant should be given if the patient is fitting into that criteria. So these are the reversible risk factors, and it is important for you to take home this message that as soon as the stroke symptoms are recognized, it is pertinent that the patient is brought to the emergency department and an urgent brain imaging, whether CT scan or MRI scan, is done as soon as possible so as to give him the best possible chance of a recovery. The usual window period as outlined in books is 4.5 hours for IV thrombolysis, but it can be extended up to 9 hours after doing some advanced imaging tests. And if we talk about mechanical thrombectomy, that is removal of the clot through a blocked blood vessel, that can happen up till 24 hours. So it is important that the patient be brought to the emergency department, and it should be done as soon as possible. It should not be that, okay, it's only 1 hour right now, I still have 3.5 hours, I can go later also. Because with every passing minute, rather seconds, multiple brain neurons are dying, and those neurons which are dead cannot be brought back to life. So it is important to act fast. Thank you.